On your health tonight, a presidential case of COVID-19. After testing positive Wednesday, we are learning President Biden remains isolated at home in Delaware with mild symptoms. And here to answer questions is Dr. Simone Wilds, an infectious disease specialist at South Shore Health. Thank you so much for being with us.
Hi, Dr. Wilds. And as you know, the president is 81 years old. So in your opinion, could it take a little longer for him to recover?
Well, first, I want to wish the president speedy recovery based on what we know from data. And yes, I'm not a part of the president's treatment team, but we do know that elderly people tend to take a while to recover, mainly because, you know, their age and their immune system doesn't work as well as their underlying conditions. Now, the elderly people are at the highest risk for getting COVID, which is why it's very concerning. Now, we do know that, you know, based on the data they have shared, is that the president has mild symptoms, his vital signs are stable. And very important, he's been vaccinated, boosted, and he's received early treatment with Paxlovid. So these are really very important steps that should help him to recover soon.
And guidelines for recovery have been ever evolving in the past, couple of years. What do the current guidelines say about staying away from other people if you do have COVID-19?
Yes, that's true. We have gone through so many changes with the guidelines. And currently, CDC recommendations are that if you test positive for COVID, first, we want you to isolate until you are without fever, without taking any medication, or your symptoms have improved. And in addition to that 5 days after your diagnosis, then we're going to encourage you to wear a mask, do physical distancing until all the symptoms have been pretty much resolved.
Now, we know the number of COVID-19 cases has been increasing nationally, but what about here in Massachusetts and even in New England?
Well, you know, as we've seen nationally, we have seen here in Massachusetts, the numbers have gone up significantly with regards to COVID, as well as hospitalization. We've talked about wastewater data. That has also increased, which is usually a precursor to tell us what's going on in the community. So with that being said, I would definitely want to make sure we tell everyone we want them to protect themselves and others. And one of the things I always talk about is if you have not been vaccinated or boosted, this would be a great time to get that done because COVID is still here with us.
Dr. Wilds, we always appreciate your insight. Thank you so much.
Thank you too.